I'm often asked, Amr, why should I care about coding? I have billers and coding companies that handle this. Why is this something that should be relevant to me? And the answer is interesting. So ASTRO sends out a survey every year asking members what is their biggest concern. And payment and reimbursement issues always come out at the top. So I would say understanding the basics of coding is really essential because it's what keeps your practices open. Coding is the language that turns treatment into value. And for those of you who are international, I would say it's also interesting to pull the curtain back on what happens in our crazy US healthcare system and compare it to yours. So I know there's different levels of knowledge in this room about coding, so we'll level set and start with the basics. So what is a code? Well, the AMA has codes which have value, and that's how we get paid. How do we broadly code for radonc services? Well, I know it's oftentimes joked that radiation oncologists sit behind a desk and ask somebody else to push the button. And we know that's not true, but what we do in our entire process of care has codes. So from your initial consultation to the clinical treatment planning, which is the cognitive process of deciding what dose you want to give and what modality you want to use, the devices we create to immobilize the patients and shape their beams, the contours we work on with our dosimetrists, the treatment delivery that our therapists give, the imaging we do daily to make sure that things are accurate, and the weekly checks we do with the patients to make sure they don't have side effects. All of this is billable. So who is the RUC? Well, the RUC is this committee, the Relative Value Update Committee, also part of the AMA, that sets the value for codes, and it decides when we need codes revalued. Every specialty has a representative to the RUC. I serve as our ASTRO representative to the RUC.